Hey guys, so this is my presentation over my literature review, which is the effects of exercise for treatment of post-traumatic stress disorder. And so to start off with a little background information, research on the topic of exercise and anxiety and depression has been done a lot, um, but there was not much that had been done on the effects of exercise and PTSD. But there has been a recent influx of clinical trials and studies supporting the claim that exercise is beneficial for the treatment of PTSD and other trauma-related disorders. And so there are specific types of physical activity, including aerobics and resistance or weight training, um, that have shown negative correlations to symptom severity in PTSD and also positive correlations to quality of life. And so during this, sorry about that, during this, there's going to be a discussion of potential benefits for physical activity and PTSD symptoms, implementation for counselors, and different populations and medical restraints that could follow. All right, so during the introduction, I talked a little bit about physical activity and physical health. Specifically cited this study by Pozadski of 2020, and it talked just a little bit about how exercise and physical activity have been proven to reduce mortality rates and also to an increase in quality of life. And so, also in 2008, the first recommendation guidelines for daily physical activities were published, and it suggested that aerobic exercises for a prolonged period of time may provide huge benefits for physical activity, and that includes a decreased chance of chronic diseases. And so then I get a little bit into physical activity and mental health, right? And so in the study by Giles of 2020, in youth populations, it showed that physical activity was shown to improve symptoms of major depressive disorder. Um, and then aerobics and anxiety in the study by Roman Folks and Story of 2008 showed a reduction of symptoms in anxiety. And so to get a little bit more into exercise and symptomology of PTSD, exercise interventions were definitely limited in the past, as I said, but again, there was a recent influx of clinical studies that showed benefits for exercise for PTSD symptoms. And so, to get a little bit into symptoms for PTSD, this is straight from the DSM-5 TR of 2022. Um, so some symptoms of PTSD are traumatic memories and flashbacks. There's sleep quality issues surrounding specifically dreams and traumatic dreams of the event that occurred. And then also distress due to triggers. And those triggers can be external factors or internal. And so then it just kind of gets a little bit into how exercise interventions may be beneficial for some of these symptoms, specifically sleep quality. But again, we will get more into that later. So, to get a little bit into the review of relevant literature. So, aerobics. Aerobics is a type of exercise that utilizes large muscle groups, and it's typically done in a rhythmic and repetitive manner, and it increases heart rate. And so, some examples of aerobic exercises that includes walking, jogging, bike riding, cardio-specific routines, and then a big one is swimming. And so there has been some studies done on aerobics and anxiety. As I mentioned earlier, the study by Roman Folks and Story in 2008. But it does have implications for PTSD treatment because the DSM-5 talks about how anxiety is a huge factor in PTSD, such as persistent avoidance of stimuli associated with the traumatic event. And so that anxiety factor can be helped through exercise. But to get a little bit more specific with PTSD treatment, there was a study done by Vorendonk of 2021, and it explored the sequential effects that prolonged exposure therapy and exercise-based interventions had on PTSD symptoms. but specifically the vividness um, and distress concerning the event. And so during this study, individuals were either taken on a 3 kilometer walk before or after undergoing eye movement desensitization and reprocessing treatment, or EMDR. And that was done in a span of 8 sessions over a 2 week time span. And so these results showed that those who participated in physical activity following the EMDR session reported a higher degree of reduction in trauma-induced vividness and distress compared to those who completed the physical activity prior to the exposure treatment. However, both of these groups indicated a significant reduction in symptoms over time. And so that kind of provides some evidence towards the effectiveness for the use of exercise-based interventions for these PTSD symptoms, especially when paired with prolonged exposure therapy. And so now we're going to get a little bit into resistance and weight training. And so Cleveland, the Cleveland Clinic, um, and this was posted in 2025, described resistance or weight training as a type of exercises that uh, use muscle tension, um, or sorry, um, it focuses on tension of the body's muscles using the weight of the body or just separate weights. And so resistance training can be broken up into two categories. There's isometric and isotonic. Isometric exercises is like pushing, pulling, and lifting, whereas isotonic requires the individual to occupy a position for a short period of time, resulting in muscle fatigue, which can be done like planks, for example, if you know what those are. Um, and so the Cleveland Clinic also talks about potential benefits for resistance training, which is mental clarity and overall health and performance. But multiple studies have been done over PTSD symptom reduction, like Whitworth of 2019. And during this study, it assessed the effectiveness of a 3 week resistance training regimen for individuals with depression, anxiety, and poor quality of sleep that all screened positive for PTSD. And the results showed that those who participated in this resistance training regimen reported a better quality of sleep and a reduction in anxiety symptoms with those with PTSD. And it also kind of provides some clarity on the topic, considering that the effects of resistance training for PTSD symptoms is a subject that has been completely disregarded and virtually untouched. And then there was another study done by Peeble of 2024, which talked about the PTSD symptoms and reduction for them for specifically women. And so during this study, they made the claim that poor sleep quality, depression, anxiety, and PTSD symptoms can be reduced by resistance-based training interventions, um, all for people and women that screen positive for PTSD. And so these subjects were randomly assigned to either a 3 week resistance training program or a non-exercise time match control. The group that went through the physical activity program showed a decrease in anxiety, depression, and PTSD symptoms. Um, and again, these were all women with PTSD. They also reported a higher quality of sleep following the intervention, right? And so the implications of this study kind of show that there is no gender bias for this exercise-based intervention that's being discussed, which is really cool, especially considering a lot of clinical trials are done primarily on men. So seeing that this is also effective for women is huge for this field. And so now we're going to get into implications for counselors on future treatment. And so the first thing that needs to be discussed for the implications are the implementation of the intervention, right? And so the first thing that needs to be discussed within that is preference. So some research done by Ashton 2017 showed that men and those with depression prefer resistance and weight-based training over aerobics, right? And so a big part of this is that we cannot generalize um, this population due to the comorbidity rate of PTSD and other mental health issues. So we can't just generalize that men and those with depression are going to prefer the resistance-based training over aerobics every time. And so due to that, I would suggest that gaining their preference during the initial assessment would be the smart thing to do. And then the next thing that needs to be talked about is the sequence of the intervention, right? And so again, we go back to Vorendonk of 2021. And so it showed that the sequence of the intervention affects the outcome of treatment. Um, and it provides evidence that physical activity may produce better results if implemented following prolonged exposure therapy, which again in this case was EMDR. Um, and so definitely take that. That should definitely be taken into consideration um, before implementing the treatment. And then another part of this is longevity. Um, and so I'm just going to start off by saying that more research is definitely needed for this because, of course, all that's been done is these clinical trials and whatnot. But along with that, success has been found with these 3 week time spans for the intervention, which can be cited with Whitworth and people. And so another part of the implications are populations. And so these are more populations that may benefit from exercise interventions aside from PTSD patients, right? And so this is more just expanding on populations that could have benefits from this exercise-based intervention. And so one of them is youth populations with major depressive disorder, as cited by Giles. It 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 ended up decreasing symptoms for their depression. And then for Broman Folks and Story of 2008, they used exercise-based interventions for anxiety and panic disorders, which all resulted in decrease of symptoms among the the patients in the trial. And then in Sleep Wake Disorders by Hugh et al. 2025. And this one was really interesting because it examined the outcomes of a combined intervention using aerobics and resistance training for male college students with delayed sleep wake phase disorder. And so the results showed an improvement in quality of sleep and a decrease in time taken to fall asleep for those with the disorder. And then finally, there is evidence to support the claim that exercise benefits those with substance use disorders. And in a study performed by Brown of 2010, um, they used exercise-based interventions, and it ended up decreasing substance use in the patients in the clinical trial, but it also increased the patient outcomes uh, over time. And this was done over 12 weeks. So a little bit longer longevity there. And so next is medical restraints. And a lot of legal and ethical issues may arise without physical screenings. And so I suggest a policy for screenings that would include um, getting a physical by a medical professional prior to the implementation of this intervention. And so some physical limitations may also apply. Those with paraplegia are not subject to being turned away from this intervention, but I do think that alternatives may need to be studied in some trials to see the effectiveness um, before implementation with this population. Um, and then, along with the medical restraints, I wanted to touch on eating disorders and the population of those with eating disorders, specifically anorexia nervosa, bulimia nervosa, binge eating disorder, and purging disorder. And so, the reason I wanted to mention this is that exercise may conflict with the ongoing treatment that they're already getting for their eating disorder. And so, um, definitely checking and maybe getting in touch with their other professional that is treating that disorder may be useful before actually implementing that intervention. But again, a caution of discrimination must be noted because turning someone away just because they have a specific disorder may not be the most feasible thing. And again, for just an overall caution of discrimination, Ableism in culture must be recognized and taken into account when accepting and declining these services. And so, to conclude, exercise interventions have shown success for PTSD symptoms and other symptoms for other populations. More research definitely needs to be done. As I said, there has been a recent influx in research for this topic, but more research should definitely be done for implementation purposes, like longevity and everything else. But it has shown an increase of quality of life across all of these clinical trials, which is great. Um, Implementation again needs to be studied more, and a wide variety of populations may benefit from this. And that includes PTSD, major depressive disorder, panic and anxiety disorders, and sleep-wake disorders. Um, and then plenty of research pointing towards the success for PTSD symptoms and the reduction of those thereof has been done. And this leads me to believe that the implementation of this intervention could be groundbreaking for the treatment of individuals suffering from PTSD if ingrained into common practice. And so that is all I have. And here are my references. Thank you.